Okay, so let's talk PCOS, also known as polycystic ovarian syndrome. So, PCOS affects about 1 in 10 women of reproductive age. And one of the key symptoms is an elevation in androgen markers, which are considered mostly male hormones, such as testosterone, that cause irregular periods, unwanted facial hair, acne, and also unwanted weight gain. So, PCOS puts women at risk for multiple conditions, including um, prediabetes, diabetes, obesity, which in the long term, if left untreated, turns into other conditions such as high cholesterol and increased risk for endometrial cancer. That's something we don't want to see happens. That's why we need to treat it correctly. Um, One of the common symptoms that I see as well is patients that struggle with increased anxiety, especially the young ladies have increased anxiety and depressed moods, and that's because their hormones are completely off and they don't feel well at all. So, if you suspect that this is something you or a loved one may have, key tests that they should be looking for include, because it's mostly an endocrine disorder, so we really need to look at the blood work. That really is a lot more sensitive than doing the ultrasound alone, because the ultrasound alone, especially if done in a young woman, isn't always going to be as super informative. So, you want to see a testosterone, a free testosterone, and a total testosterone order. Do you want to see a sex hormone binding globulin ordered? Do you want to see progesterone and estradiol ordered, as well as the fasting insulin level and the A1C to see if they're already showing signs of insulin resistance and an increased risk of diabetes? You want to see how the stimulating hormones from the brain are, your FSH and LH. Is there a pattern that's showing a flip, and how much of one or the other is being shown? Um, a DHEA is a marker of adrenal health. A lot of women with PCOS have adrenal hypertrophy. So there's an extensive panel that can be ordered that really will give us a lot of information about what is going on with the patient. And another thing that I do find is that a lot of my PCOS patients also have thyroid disorders as well. So it's just a hormonal endocrine disorder mess that these young women are in. And sometimes they go years without a proper diagnosis and proper treatment, which is just a crime, in my opinion. So, if you or someone you love has had PCOS or has symptoms that make you suspect that they may have it, difficulty losing weight, difficulty getting pregnant, irregular